Sure. So I thought we would, first of all, thank you all for coming in today. My name is Malek. I thought we'd start with a little bit of introductions. I'll be presenting on the counseling of Syrian refugees with Islamic principles of psychology alongside Dr. Makri and Dr. Wright. If you're in the right room, then I'm glad. If not, maybe you can hang on and maybe you'll learn something and find this helpful. But yeah, so just a little bit about myself. I am 3 years into the end of my clinical mental health counseling program at the Chicago School of Professional Psychology. And throughout this educational journey, I find myself getting really much interested in issues of multiculturalism and diversity. And I feel like that personally resonates with me because due to my life experiences, I feel like, or I have lived in multiple places. I grew up in Lebanon and then I ended up moving to the US for my higher education, and now I'm in France. And throughout this process, and with my education, I've kind of find it interesting to explore counseling and practices and perspectives on counseling with diverse populations and with that lens. So yeah, that's a little bit about me, and whoever wants to go next.
I'll go next. Thank you, Malek, for your introduction. My name is Dr. Stella Michael-Makri. I am really honored that Malek has chosen us to present with him. I'm an associate professor at Columbus State University, and my research interest relates to multicultural competencies and practices. And that's it. Dr. Wright.
Hi, everyone. Thank you for being here with us this morning. We're really excited to speak with you about the topic. My name is Dr. Stephen Wright. Like Dr. Makri, I am an assistant professor, however, at Columbus State University in Columbus, Georgia. As it relates to my research interest and why I'm part of this presentation is that I'm involved in research related to multicultural development for counselor trainees, but also improving services for marginalized populations.
All right, awesome. So thank you for that, Dr. Makri, Dr. Wright. I just wanted to start this presentation with giving an outline so you have an idea of what to expect throughout this time that we have together. We're going to pretty much give an overview of the Syrian civil war and the refugee crisis, just in case some people here, if you don't know about it, we'll kind of give you a brief outline information on that. Then we're going to be talking about the mental health needs of Syrian refugees. Also, we'll follow up with the refugee underutilization of mental health services. Then we'll kind of elaborate on the approaches that are currently being utilized with Syrian refugee populations. And then we'll talk about the importance and role of religion with Syrian refugee population, why it's relevant to be talking about this. And then also integrating culturally relevant practices. Hopefully today, you'll get an idea of how you can use some Islamic adaptations to some current methods being used, interventions being used. But then ultimately we want to get to the future directions and what do we make out of this and how are we going to move forward with this information. And then we'll kind of wrap up with, hopefully if you have some time, with some Q&A. So we'll jump right straight into it. I just want to also start with a picture of a refugee camp. This is the Zaatari Syrian refugee camp. And the reason why I pull this up is to kind of show you the magnitude of the displacement. This is the largest Syrian refugee camp, if I'm not mistaken, located in Jordan, which, which I think is, yeah, we'll talk about numbers now in the timeline, but yeah. So let's talk a little bit about the timeline and what's been going on over there. So what is being described as the most severe humanitarian crisis since World War II started as a result of the Arab Spring and protests in the country of Syria to overcome a dictatorship regime. This led to the civil war, which started in 2011. A year later, the first Syrian refugee camp opened in Jordan, which is the picture I just showed you. It's the Zaatari refugee camp, which hosts more than 70,000 refugees at the time. And I believe those numbers are increasing and continue to increase. We also know a historical but unfortunate landmark was in 2014 when Syrian refugees became the world's largest refugee group when they passed the 3 million mark. And also, as we move into current times, we know that the Syrian conflict is the most destructive civil war that we've seen to date. We have up to 500,000 people killed and over 6 million refugees being displaced over the world.
So as you can imagine, the circumstances that have caused many individuals to flee Syria have resulted in significant mental health concerns. The literature reflects that refugees in general experience psychological distress, but for the purpose of this presentation, it's really important to look at the prevalence of mental health concerns within the Syrian refugee population. Those who are displaced because of war and civil unrest, like Malek just mentioned, experience several challenges that negatively impact their mental health. So we'll see in the next slide, if you want to go ahead and go there, Malek, that Syrian refugees specifically have substantial rates for mental health concerns in diagnoses, especially as it relates to trauma. So, and you'll see some of our references to the right, but a systematic review of the counseling literature examined various studies that reflected the prevalence of mental health concerns for Syrian refugees in 4 neighboring host countries in the Middle East. So we have Iraq, we have Jordan, Turkey, and Lebanon. And much of the literature reviewed noted concerns related to trauma during pre-migration, migration, and post-migration experiences for refugees. So in Iraq, you can look at the numbers yourself, but in Iraq, post-traumatic stress was identified among adult Syrian refugees at a prevalence rate of as much as 38%. In Jordan, although the rates of post-traumatic stress disorder were noted at lower levels, research indicated that psychological stress affected over half of the Syrian refugee population, which is a substantial number. In addition, the prevalence rate for depression was noted at 30%, which was also reflective of Syrian refugee populations' experiences located within Turkey. So when examining diagnoses in Lebanon, rates of post-traumatic stress disorder were 27%, rates for major depressive disorder were 44%, and prevalence for schizophrenia diagnosis was 38%. So Malek, if you want to go to the next slide. We have a clear understanding that these experiences mentioned earlier by Malek and the numbers that we see there impact Syrian refugees at multiple levels. Psychological levels, behavioral levels, social levels, across the board. This is certainly a significant concern, but what is also concerning is that although there are significant mental health concerns for Syrian refugees, the rates for mental health help seeking for these psychological problems are very low amongst refugee populations in general. So if you want to go to the next slide, Malek. Key barriers to seeking help for psychological problems. We're going to kind of break this down into 2 different categories as the literature reflects, structural and cultural barriers. So structural barriers for psychological problems can include things such as financial strain and unstable housing. So we can imagine and we can understand that counseling services are usually not the immediate priority of refugees, and many will not seek or take part in counseling if their basic needs are not being met. So that's a significant concern. But even if individuals are intentional about seeking counseling services, other structural barriers include language and dialect differences in the resettlement country, complicated processes within the mental health system once they are in the mental health system, and then also a lack of knowledge on really how to access or navigate appropriate mental health services for their psychological concerns. But to the right, cultural barriers are also certainly noteworthy. Mental health stigma is one of the most commonly cited reasons for why refugees fail to access mental health services. Some of those stigmatizing attitudes, such as fear of being seen as crazy, or thinking that talking doesn't help, or that service providers are ultimately not to be trusted. A lot of those things are largely determined by cultural norms and what constitutes healthy and unhealthy behavior. So in a moment, and we can transition into the next part of the presentation, but in a moment, we're going to be sharing ways in which there are also discrepancies between mental health care services provided and the commonly held important cultural values of refugees who have fled Syria.
All right, so we will be discussing approaches that have been implemented with Syrian refugee populations relating to individual and group interventions, community-based interventions, and creative interventions. Next slide, please. There were several studies that have been conducted using the EDMR approach to reduce and prevent PTSD and depression. We were able to find 2 recent ones that have were conducted on group intervention and trauma-focused therapy. And this study showed significant decrease right after treatment. However, when they went back to assess again between the control and experimental group between 4 and 11 weeks, they did not find any significant difference between the experimental and control groups. So although EMDR is effective when the treatment is implemented, it does not have a lasting effects on the refugees. Another approach that was implemented was the peer-provided problem management plus programs, where they train non-specialized helpers to implement PM plus to peer refugees. Just to give you a little bit of understanding of what the PM plus program is, this program includes 90-minute sessions that are delivered weekly and includes 4 components: slow breathing exercise, problem-solving strategy, behavioral activation through re-engaging with pleasant and task-oriented activities, and accessing social support. Although this program was generally acceptable and a positive intervention for the participants, especially because the program was implemented by non-specialized helpers, the results still indicated moderate improvement of a broad range of symptoms of PTSD. There was also a group counseling program specific to Syrian refugee women that was implemented. This program was based on Yalom's fundamentals of hope installation and socialization techniques. And this particular program showed effectiveness in the intervention of the PTSD, although the participation number was small to be able to generalize. Finally, on the individual and group interventions group, another model that was implemented was the multi-tier mental health and psychosocial support model. And this specific model includes a holistic approach of care for system-level collaboration and coordination, which is very essential to refugees' mental health care. To explain a little bit more about this model, it has 2 pillar approaches. The one is trauma-informed psychosocial program, and the other one a cultural informed mental health services. And they include 4 tiers. The first and second tier, which is the social adjustment and integration and family and community support system, is under the cultural informed pillar, whereas the bereavement and trauma healing and specialized in mental health treatment tiers are under the trauma-informed pillar. What they have found out is that this community-wide intervention was crucial for the promotion of community resilience because it went beyond the individualistic treatment and it included the community as well. This last approach seems to align better with the cultural values and the norms of these populations. And if Islamic principles and values would have also been added, it could have strengthened the outcome of the study and the results. Next slide, please. 2 main community-based interventions that have been used includes the Lay Health Educator Program and WHO's Mental Health Gap Action Program training. The Health Educator Program was an adapted version to serve this specific population, and although it was an adapted version that was implemented that provided training to volunteers. So they provided 6-week training to members of the mosque about healthcare related topics. And it is important to note here that this is the only study that has taken place at a mosque, and where they have actually used members of the mosque to train and provide services to the refugees. Some of the events that were included were health events, heart health awareness events, vaccination and prevention care events, and various healthcare topics. And it's also important to note that although mental health was included during these events, there was not a standalone event specific to mental health, which relates to what Dr. Wright was saying before in regards to the stigma of mental health. What they have found out is that the services provided, there was a significant impact to health and healthcare education for the refugees. And although this training took place, an intervention took place at a mosque, still Islamic principles of psychology were not included in the training. In regards to WHO's mental health gap action program training, this program is specifically designed to increase services for mental, neurological, and substance use disorder. And this training is offered to doctors, staff and consultants, and as well as multidisciplinary teams. But what they have done specifically for this study, they have taken the program, and again, they train non-specialized primary care personnel to increase early detection of treatment of mental health. This study included a good number of participants. Their sample was 357 participants, and they had a pretty high outcome. 96% of the participants found the training beneficial, and they have noted that the most useful topics were the ones promoting of mental health and depression, even though, again, there was no specific event relating to mental health. And next slide, please. Two other interventions that we have found where we call them creative interventions just because they were a little bit different from the traditional ones we were able to find. There was a study conducted using participatory theater intervention where the participants, they had to act out their lived experiences of coping with trauma and exile. This study focused on within group interactions where they have used play to explore the role of community relations in the way people deal with experiences of collective violence and forced displacement. This specific study enabled participants to reshape cultural belonging in the aftermath of collective violence and cultural fragmentation. It also provided the opportunity to the participants to tell their story through movement and nonverbals. This study could have been more beneficial and powerful if religion or Islamic principles and values were also incorporated. And lastly, this is the most recent study that we were able to find from 2020, is relating to mental health. So they have used an adaptation process of step-by-step, which is a web-based mental health intervention that has been developed by WHO. It was a small sample of 28 participants, and the results indicated that 78% reacted positively, stressing again the potential health impact of the intervention. Some barriers, though, to mental health was acceptability, credibility, and technical requirements. Next, please. So what is important to note here is that none of the approaches that have been currently utilized with Syrian refugees included any Islamic principles of psychology. You want to go ahead, Malek?
Oh, okay. So yeah, as Dr. Makri mentioned, none of these interventions that have been currently been used have used any Islamic adaptations. But we do know that culturally relevant practices are more effective than unadapted practices. So with that said, let's kind of look at the importance and role of Islam with Syrian refugee populations. Let's start with the religious demographics. We know that around 90% of Middle Eastern populations are Muslims, but specifically speaking, as it relates to the Syrian refugee population, we know that 87% of Syrian refugee families registered with the UNHCR are Sunni Muslims. And why is that? And it kind of has to do with the sectarian nature of the conflict and civil war. And we also know that Islam is deeply rooted in Middle Eastern culture. So let's kind of look at the role of Islam in Syrian culture. As it relates to, as I just said, Islam is a way of life that is deep rooted in Middle Eastern culture. We know that Islam can influence many aspects of norms and values. Some of these norms and values include language, relationships, personal hygiene, and socialization patterns. Personally, I never really practiced religion, but I can see how these also had an impact on my own life and the surroundings around me. Religion impacts the way I speak, the way I shape my relationships, my personal hygiene, and also the socialization patterns as I grew up. But what I think is important and interesting to explore is how Islam impacts the understanding of mental illness of individuals, and they attribute it to their belief in the supernatural. So as we talk about cultural values and norms, individuals who conceptualize mental health and who have Islamic faith and are dealing with mental health issues kind of look at it as a trial from God. We know that in Islam, life is a test. It has ups, it has downs. And with that said, individuals who have faith kind of bring that into into the way they rationalize their reality. We also know that individuals dealing with mental health understand that it might be possessions from the evil spirits, such as the jinn. Jinn is basically an Arabic word for evil spirits. Also, individuals with mental health issues might understand it as a lack of faith or envy from the evil eye, which the last 3 points are, or at least the envy from the evil eye and the jinn are kind of like these supernatural beliefs that are kind of related to religion. And what's also interesting, I found, is that given that these cultural values and norms impact their understanding of mental health, it also impacts their primary treatment practices. Individuals with Islamic faith, or not to generalize, but we've seen that it's very common for religious Muslims in the Middle East to seek help through spiritual leaders instead of seeking help with professional mental health, professionals in the mental health field. We also see that they will heal and kind of cope with their challenging times through prayer. And we'll also see that they will be healing by reading the Holy Quran. So all of this is to say that Islam is impacting the culture, impacting the way they're seeking out treatment practices, right? So let's kind of look at also what is the role of Islam in mental health outcomes. We want to investigate if there's a positive role. What does it have to do with that? So with that said, we know that individuals with religious lifestyles can utilize faith as a source of treatment and healing. There's a lot of research on this topic. We know that there's a lot of recent trends in our profession that are moving to holistic approach. We talk about the physical, the mental, the spiritual, and all of this is interchangeable. And we've seen that individuals with religion can utilize that faith as a sort of treatment. Specifically speaking, with Syrian refugees, we know that they rely heavily on their faith to stay mentally strong. I think it was an interview in Lebanon, actually, where they looked at participants and interviewed them, and they found that Islam was a means of providing hope for the Muslim refugees. They also said it helped them overcome these challenging times, and it was a mediating relationship. There was a mediating relationship between Islamic faith and resiliency. So now we know that Islam is plays an important role in culture. There's obviously a dense population of Muslims within the Syrian refugees. And lastly, Islam plays a positive role in mental health outcomes. So let's kind of look at integrating culturally relevant practices. Over here, for the sake of this presentation, we chose just 2 interventions because I feel like they fall in line with the cultural norms and values that we just talked about. So we'll talk about CBT, cognitive behavioral therapy, give a brief description, and then talk about an Islamic adaptation of it. Then we'll talk about EMDR, describe that a bit, and then talk about Islamic adaptations as well. So starting with cognitive behavioral therapy, just a brief description of what it is. It shows the interchangeable relationship between thoughts, feelings, and behaviors. So basically, kind of to illustrate this, if someone has a negative thought, they would have a negative feeling and in turn have a negative behavior. However, if they're able to replace that negative thought with a positive one, they will have positive feelings and positive behaviors. So what's culturally adapted cognitive behavioral therapy? CACBT, if I'm not mistaken, is founded on like 12 major tenets, one of them being falling under some mindfulness-based cognitive therapy. So similar to that cycle we saw before with CBT, it's kind of replaced with mindfulness techniques. And what these mindfulness techniques do is they bring you to the present moment. They shift your thoughts away from negative to more positive mood states, which kind of gives you this acceptance of all the incoming thoughts and feelings that you're experiencing. So let's see how we can use this within an Islamic adaptation. As discussed earlier, there's mindfulness techniques, which is the behavior. A big part of mindfulness techniques is your attentional focus, and kind of to break that down, it just kind of describes the idea that your focus of attention determines your mood. So if you're focusing on something negative, you're going to have a negative thought and or reaction, and if you focus on something positive, you'll have a positive reaction. So also to further illustrate, there's a difference between the mood change when attention is focused on negative rumination versus when you're focusing on Islamic mindfulness strategies. And what are these type of mindfulness strategies? There's dhikr, the practice of chanting God's name. There's ru'ya, which is the recitation of the Quran. There's dua, which is supplication. And there's salah, a ritualistic form of prayer, which all of these are things that people of Islamic faith practice religiously, no pun intended. So yeah, I mean, even I can think about my grandma who's like praying 5 times a day and making dua all the time as a meditative practice as well. That's related to her, worldview. So we have these mindfulness techniques that shift their attention away. They bring the individuals into their present moment and shift it away from a negative to a more positive mood state, allowing to have these feelings of acceptance. So now let's talk about eye movement desensitization and reprocessing, also known as EMDR. So EMDR is a psychological treatment for PTSD that involves a client recalling traumatic memories while simultaneously making horizontal eye movements or engaging in other bilateral stimulation. So now let's break that down. EMDR is basically an intervention that is very well known to be effective with individuals dealing with trauma. And I think Shapiro is the individual who created this intervention, noticed that individuals who recall traumatic memories have this kind of reaction where their eyes kind of goes back and forth. And this EMDR is a way of desensitizing that reaction and allowing them to access and kind of process those traumatic memories through, further counseling. And I want to show a quick video just to illustrate what that looks like. So you have the therapist talking to the client who's bringing up traumatic memories. They will have this, in this case, a pencil that's moving in that bilateral movement, kind of allow to desensitize and process what's going on with them. And I'll tell you, when I first learned about EMDR, for a long time, I was not buying it. I thought it was some sort of hypnotization. I thought it was witchcraft, but I think it's also important to know that culturally, with my background from Lebanon, it seems quite strange, right? Or at least for me. Let me talk about myself with this one. But what is interesting is we want to find Islamic adaptations, because Dr. Makri just talked about how, Syrian refugees who went through these interventions, which is known to be very effective with PTSD, didn't have long-lasting effects. In fact, they relapsed after the intervention stopped. So let's talk a little bit about some Islamic adaptations or opportunities for Islamic adaptations with EMDR. So the expression of dhikr, which we mentioned earlier, is a type of Islamic prayer. During some of these dhikr, individuals discuss their problems and thoughts and emotions, dreams with a sheikh or the Muslim religious scholar. During the rituals, participants will move their bodies and heads while in a semicircle around the sheikh, which may cause eye movement in addition to rhythmic bilateral movements similar to in EMDR. Again, that seems like a lot to unpack, so I'm hoping that I can show you this video. It's only 20 seconds, so kind of bear with me here. And you'll see that the people on the left are the participants, or like the individuals that are kind of participating in this ritual. And this individual over here is the sheikh, who's kind of chanting the prayers, and they're reciting after him. And then sometimes they even walk in a circle around him, but I don't have that in this video. This is like a 7-minute video. So I'm just going to show you this so I can kind of illustrate how this can be an opportunity to include Islamic adaptations to EMDR. All right, so once again, maybe some of you might think this is bizarre or different, and then again, that's what culture is. So we're just trying to highlight that there are opportunities for integrating adaptations that are relevant to their culture. So yeah, so where do we go now? We talked about culturally relevant interventions. We also, and we'll kind of discuss that in a bit, and we also want to explore future movements towards Islamic approaches. So as it relates to the ACA Code of Ethics, as a student, I have a love and hate relationship with the ethics, but no, I mean, obviously we have to kind of adhere with them. But yeah, we know that there should always be a scientific basis for treatment services. As it relates, we always need interventions that are empirical, evidence-based. It's not a gut feeling that we want to go through. We want to make sure they work, right? We know that CACBT is an effective treatment. We know, in fact, that it's been tested many times with refugee populations, and it's effective. But we need to see if it's effective with Syrian refugees. Let's live up to these ethical codes and what we need to do to push this profession forward and kind of test those and kind of put them in place. Also, as it relates to the effectiveness of EMDR Islamic adaptations, let's look at future research. Let's examine if these head and eye movements during dhikr do have effects similar to the eye movements during EMDR. Let's also investigate the effectiveness and accessibility of treatment combining some of dhikr elements with EMDR procedures. We know that there's a lot of mental health stigma in the region. We know that people are reluctant to seek treatment with mental health professionals, but let's bring it into into a way that's relative to their worldview and see if it's something that's accessible and effective when working with them. And then lastly, as it relates to future movements towards Islamic approaches, we know that one tenet of the multicultural and social justice competency model suggests that we should always seek for counseling and advocacy interventions. Specifically, in the model, it describes that we should include interventions that align with the cultural background of our clients. In this case, we're talking about Syrian refugees. So let's integrate Islamic principles of psychology with interventions that are currently being utilized with Syrian refugees. Let's also, which is another tenet, to work in communities to better understand the attitudes, beliefs, prejudices, and biases held by Syrian refugees. We have to gain an authentic and deeper understanding of Islamic principles of psychology. We also need to include Muslim practitioners and scholars. Our profession is built on collaboration. So let's do that and collaborate with the communities and get this real understanding of what's going to really work for them. And then lastly, and the ultimate goal is to move towards approaches that are grounded in Syrian refugees' culture. So that brings me to the end of this presentation. I will say, with that note that I just ended on, we're talking about a specific population here. We're talking about Syrian refugee populations, and we want to provide services that are relative to their worldview. And I would just hope that anyone who's working in the mental health counseling profession to also take this to their own populations. So now we're being specific about Syrian refugees, and I do hope that you take this on with your future as you move and work with your own populations. And then one last thing is, I know if there's anyone here interested or working with similar populations, there's a lot of free resources online about these adaptations. So feel free to reach out to me where I can provide them to you, and we can discuss anything of that sort. So thank you so much for coming in today. And if there's any questions, hopefully we'll have some answers. Can I stop? Do I have to answer this, Doctor? Let's see.
Can everyone see the poll questions that came up? It should be available to everyone.
I think the first question is a multiple choice, and they can't type their answers in, but that's cool. They can get an easy one. I hope I pass this.
Hope you do too.
So can I stop sharing? I don't know, how does this work? Is there a room monitor who's going to be reading out the questions, or?
Okay, can everyone see the questions? And really, for the questions, they're just some required engagement. Everybody can kind of answer those and look through them. Malek, you can see them, correct?
Let's see. Making the poll. Yeah, I see people. Yep. I don't see any questions, but I see them texting or typing.
Me too.
Do our participants have any questions for us, or any experiences that they would like to share with us? Any comments? Since we do have time, we would like to interact with you a little.
Yeah.
I actually have a question, Dr. Makri and Malek and Dr. Wright. So I actually have had this conversation with Malek before, but I would be really interested to know culturally and both from like a religious standpoint, how does this affect like the different like genders, like male, female, or like in the community with like, I don't know, like LGBTQ, is that even like accepted, or just, I'm always interested in that aspect.
Yeah, I will say that when we talk about, we kind of focus on Islam, but I think the ultimate goal is also to examine their whole culture, and you're bringing up very great points. Because culture is so diverse. There's, ethnicity, religion, sexual orientation, as you mentioned as well. And these are all things that we need to explore within the culture of Syrian refugees. And that's the ultimate goal, is to move towards, theories that are kind of embedded within their culture, but also, just to know how they view them. Because we know as counselors, at least in our ethical codes, we shouldn't enforce our values on people. But also, we still need to advocate, but also we have to see their worldview. You know what I mean? That's how I think. I don't know if if Dr. Makri or Dr. Wright, if you have anything to add.
Caitlin, I do want to share that when I was looking at the different interventions that were used and the participants, the majority will be either females or young adults. For studies that males have volunteered to participate, at some point they dropped out. okay, which I believe relates again, you know, with the stigma, but also asking them to go deeper, right? Exploring areas that are not comfortable with, not familiar with, right? That's why we believe that it's so important to make sure that cultural norms and beliefs are included. Also, we would like to know that all these studies that we presented to you were conducted in Belgium, Jordan, Turkey, all right? And again, you know, even there, they use more of the Western approaches, right? In regards to LGBTQ plus population, we have found nothing relating to, you know, demographics, you know, even for the, you know, which again is pretty telling when we were looking at the demographics of the participants of each study. You know, it would be either male, female, some age range, and that would be it. So there is so much more to explore on this topic and be aware and familiar with.
Yeah, and just to add, Caitlin, I think that's a great question because you're focusing on intersectionality of identities, which is something that we have to keep in mind, both about ourselves in regard to our self-identity as counselors, but the identities of students or clients that we're working with and how those interact with one another in the counseling relationship. So I appreciate that question. I think we saw another hand going up.
Yes, thank you. First of all, I wanted to say this is a very interesting and important work. I live in Athens, Greece, and I teach at the University of Athens. And we have Syrian refugees here in Greece. It's sort of a transit country, you know, for other European countries. But and we did do qualitative research with listening to life stories of Syrian refugees, and many of the things that came up in your work we have found as well. You know, this importance of prayer and being a source of strength, and, you know, the cultural values and the community, you know. So I think this is very helpful, and we should try to apply here in Greece some of these interventions, you know, they make a lot of sense, because it is true that we do not have culturally specific interventions, especially for a Muslim population. So I think this is great work. And I wanted to also to ask you just a question, this dance, I mean, like the going around with the Turk, this reminded me of a dervish. I don't know if I make any sense. Is this what it is, this type of dance, or it's, is it?
Sure. So I don't know. What I do know is it's a like Islamic ritual that you'll find across, you'll find them even in Eastern Europe. So, and they do it differently. They might walk around in a circle. As for the individuals spinning around, I'm not too sure what that dance is called, but it's part of the ritual. Yeah. So I'll look that up and we'll discuss that later. It's nice to see you.
Philia, we did find one article actually from Greece that was looking at, and I was trying to find it to see if there's anything, you know, relating to what you have been doing. I do want to mention to you that I am from Cyprus, so I'm familiar with all the hard work that has been done there, you know, in Greece and Cyprus with the refugees. So thank you for joining us today. It's an honor to be here with you.
Yes, we are writing an article related as well. So that this is, your work is very much it's enriching, you know, this whole area. Yes. Thank you.
I
guess we're getting some virtual high fives.
Yes, we are. It's very encouraging and wonderful to see the support. Our goal is to move forward with an article and do more research and just, you know, explore this very important topic more. So as I said before, we're very fortunate and honored that Malek has invited us to do this research with him.
I appreciate you all. No, I'm fortunate that you're part of the team. Thank you all. Yeah.
I think to kind of piggyback off what Malek and Dr. Makri are saying, we as a team still have a lot to learn because there's not as much published. And Malek mentioned too, we don't necessarily practice Islam, so we have a lot to understand about integrating these practices. And I see some feedback in the chat kind of giving us a little bit more information. And honestly, I mean, that really reflects what culturally relevant practices are. You can't know everything, but it's really important to integrate and understand what is of value and what is of importance to the clients that we're working with. And part of that is getting to know, okay, a little bit more yourself, increasing that knowledge base. But when you don't know, having that conversation about what is important to you, what do you value, how can this be used as a strength for you in counseling services. So we have a lot to learn as a team, but we're very excited and we appreciate the affirmation about the importance of this project in particular.
And I'm just realizing that those might be raised hands, but.
Yeah, we have a couple of raised hands there. When do you want to ask the question? Go ahead.
Sure.
Hi, my name is Carmen. I work in Lebanon. We work mainly with Syrian refugees, and I was really excited to see this topic. Thank you so much for sharing that. It is very important to integrate culture and religion in a way, and to understand it in order to actually succeed in therapy, for example. Sometimes from the most basic things, like basically thinking about even gender can have a big role in Islam. This might enable or allow the person to feel more comfortable in therapy. If a person is a bit distanced from the culture of the patient, then of course the client would not maybe succeed as much in therapy. Sometimes it can be as basic as setting the appointment. Sometimes putting it on a Friday would be a bit insulting to some people, because Fridays, for example, are the day where they would pray. I mean, they do pray every day, but Friday is a special day. So yes, thank you so much for sharing this, and it is really, really important. And I also wanted to share one more approach that we found to be very successful. It is a Cbt based approach. It's Common Elements Treatment Approach, CETA, and that's what we're mostly using right now at our center.
Yeah, Carmen, thank you for that. And like you said, you know, how the culture, even with the gender norms, and I think when we think about integrating culturally relevant practices, and we talked about primary treatment approaches where they seek these religious leaders, that's also a factor, you know, like if you are putting it within the realm that's accessible and acceptable to them, you know, the ultimate goal is to do something of that sort, right? But obviously, you know, Islam is so important and relevant in their religion and their culture, that it needs to be considered. So that's definitely a great point. Yeah, so I think we have Leen Abu Zaki who has a question as well. Thank you, Carmen. I think you're muted.
Okay, hello, thank you for your presentation. It was very interesting and relevant. I also work between France and Lebanon. I work in the same structure as Carmen. So I wanted to, so I liked when you talked about resiliency and Islamic faith, because like regarding suicidality, this is super important. And I think that it could really, like it's really seems to be a very big protective factor regarding suicidality. And I'm sure that there's a lot to explore there. And I'm wondering how we could explore it more and use it more regarding suicidal prevention. That's one thing. And I also enjoyed that you showed us in the beginning of your presentation the picture of the Zaatari camp, because it made me think of like the trainings that are usually made for psychologists who work with refugees. Usually it's very mental health focused, but not much about the bigger context and the bigger cultural background or the religion details and practices. And I think that this should be like, would be very interesting as part of the training and on how to integrate both. And a question to you is like, do you have a specific example on how you would apply a culturally adapted CBT approach to a specific situation? I'm just curious if you have a specific example that you could share with us. That would be great.
Sure.
Thank you.
I'll just quickly answer your last question, is that there are manuals. It's not culturally adapted CBT, but it's religiously adapted CBT. There's like a 12, like there's a framework that's free. It's out there. It's adapted to all religions, including Islam. And the reason why we didn't include it in this presentation is just because we wanted to focus in on those cultural norms and values that are relative within those interventions. So to answer your question, there is some resources as it relates to CACBT. I know there's been articles that explored pretty much what I went over today. They did that in a study with Egyptian. They weren't refugees, but they were Muslim Egyptians. So there is literature out there. There are resources on how to implement them. There's like the framework and everything. So definitely you might need training in them. I'm not an expert in those interventions yet, at least. And then to answer your question about suicidality and resiliency, you bring up a great point, because with Islam, it provides these individuals with hope. It provides them with meaning, a sense of meaning, and they're able to cope with all these challenging and stressing times. So it's definitely something that needs to be explored. Again, there is literature that kind of points out to the positive and mediating relationship between them. But the more we investigate this, the more we're going to realize that this is relevant and this is their worldview and how they navigate their life and kind of deal with mental health issues. So definitely, yeah, I agree with you.
I wanted to ask Carmen really quick if she can please tell us again about you said CETA approach, Carmen?
Yes.
Can you tell us a little bit about this and what
yes.
CETA stands for?
Yes, Common Element Treatment Approach. It's a CBT evidence-based short-term approach, and usually it's around 8 to 12 sessions. And there's an adult and a child module, so you can implement it with all different age groups. And it is mainly targeted towards people who have trauma, anxiety, depression, substance use, or even behavioral problems. So it is transdiagnostic, basically. And some studies have been implemented in the Syrian refugee population. There was one recently conducted study on telephone CETA. It was done in informal tented settlements in Lebanon. And it has been shown to be very effective. And at least from our beneficiaries at Restart Center in Lebanon, it has been very remarkable, honestly.
Thank you, Carmen, for the additional information.
And to the group, I just put in the chat a link to an article about religiously integrated cognitive behavioral therapy. So it kind of piggybacks off the conversation that was happening a moment ago. And as Malek mentioned, there's, it's a good starting point to dive in a bit deeper within that particular area, but it's kind of applied across the board, across various religions. So you might find that to be interesting.
Thank you.
Yeah, thank you, Lynn. And like, if you want to grab our emails, I know they'll be sharing the presentations if you have any more questions for later. And that goes to everyone here as well. If there's no virtual hands wanting questions, I really enjoyed sharing this information with all of you. Hopefully, you'll find it as relevant as we do. And yeah, moving towards those, values our profession kind of push us to do. So thank you for coming in, and you all have a great rest of your day.
Thank you all.
Thank you, everyone.